I have a long history of orthopedic issues from my feet to my knees. I like to walk around the parks. I like to hike with my family, and I wasn't able to do that. I had to stay back. I actually had to limit my nursing career due to my knee pain, so that was very disheartening. So I do a lot of dancing. Well, can't dance, but I like to act it out. But so yeah, it limited my duties and my activity with my family, so it was very sad. Working side by side with Dr. Jans up on the floor, just seeing how well all his patients do every day, I had all the interest in him to take care of me and my knee surgery itself.
Norah's been seeing us for quite a while, so she's had pain in her right knee for several years, and prior to considering any surgery, we did a course of non-operative treatment for Norah, which is what I recommend for all of my patients for osteoarthritis. This treatment course includes anti-inflammatories, activity modification, weight loss to a healthy weight, as well as injections to help decrease the inflammation and pain. Unfortunately, there are some patients whose arthritis is severe enough that eventually those measures don't work, and that included Miss Norah. And so once that does no longer work, then we recommend surgery. And given her arthritis, her advanced arthritis, we recommended a total knee replacement. ROSA is a surgical navigation robotic system, and it allows me to place a knee in a more precise and repeatable and accurate fashion. Where I feel ROSA has made an impact in patients' lives, or particularly in patients with quite severe arthritis deformities, it allows me to give those patients a proper knee replacement, but put it in a way that provides them a faster recovery than they might otherwise get from a traditional knee replacement. Also, for patients that may have pre-existing orthopedic surgery in the region, say a pre-existing plate or screws or other implants from a previous injury, it allows me to place the knee replacement often without having to take out or address those other issues. And that of course means the patient requires less surgery, which provides them a faster recovery and less risk of post-op complications because they're not requiring as extensive of a surgery.
My surgical experience was actually outstanding, I feel. From the office visit to their instructions on what to do preoperatively and what was going to expect postoperatively and the time frame and therapy, they were very educational on that and very informative. So I went through the pre-op period, and the day of surgery, everybody was so professional downstairs in the OR, even though I was so nervous. But they did so well, and it felt like it was an hour before I came back upstairs to my room. And upstairs I was an inpatient for just overnight until I went home.
So Miss Norah is about 2.5 months post-op from her total knee replacement. She's doing really well. So she's returned to work 2 to 3 weeks ago. She's very happy with her knee. She has wonderful range of motion. She already notices enormous improvement in her pain and an improvement in her function from prior to surgery. And she's extremely happy, and a very happy patient makes for a very happy surgeon.
So I am enjoying my walks. I did a little bit of hiking. I went onto the beach a little bit. My quality of life is much more improved.